James, young adult, James had a situation where he has had what we call an underbite. His lower jaw and lower teeth were in front of the upper teeth. In James' particular situation, and actually is what we probably see most often in these type of growth and bite patterns, is where initially to the eye it may look like the lower jaw is just disproportionately large, and sometimes it is. Oftentimes, and maybe even most often, it's the underdevelopment of the upper jaw and its more retrusive position within the midface that contributes to that concave look, that concavity sense to the face, and the what looks like just disproportionate large lower jaw. So in James' situation, there were a couple components to the treatment. He was in what we call an orthodontic surgery patient, and there were 2 steps to his treatment. The first step was using an expander in the upper arch to help widen the upper jaw, but that with an adult, the expansion has to be accompanied with a somewhat minor surgical procedure which results in what we call a surgically assisted maxillary expansion, where they go in, it's an outpatient procedure, they go in and they basically free up the upper jaw to allow the upper expander to work. So we had that done first, and then we used some braces on the top teeth and the lower teeth, and then he had another surgical procedure that actually moved the whole upper jaw forward to complete his treatment and to help ultimately correct the bite. When you move that upper jaw forward, like in James' situation, it typically results in dramatic changes to the bite, and also facially dramatic changes. It lends itself to a lot more support to the midface, more support for the nose, more support for the upper lip, more balance to the face. And in James' situation, he's a good-looking young man and had a stunning result.